So welcome back, everyone. Now listen up, because a lot of people might have this issue. And I have with me right now Dr. Terrell. She's the owner of Head Pain Institute. Welcome to the show. I want you to tell everybody a little bit about yourself and what you do. Go ahead.
Hi, Carol.
Mm-hmm.
So I'm a dentist, and I'm a dentist who specializes in orificial pain and treating TMJ dysfunction or TMJ disorders.
So TMJ, right?
Yes.
And that causes head issues.
TMJ is really a broad term that's an umbrella term that is used to embrace several conditions that affect the muscles of, we used to chew, some muscles of the neck, your joint, the one that you used to chew. And yes, sometimes it can present itself as headaches or with headaches.
What is a symptom of TMJ?
There are several symptoms. There are ones that are very obvious. For example, when you have pain when you're chewing, then your TMJ may be acting up, or the muscles around that joint may be having some problems. There are other symptoms that are not so obvious. For example, ear pain, which is very common but is not associated with TMJ's problems right away. So also dizziness, ringing in the ears, those are also symptoms of TMJ problems, or could be.
Now you have an educational background, and I'm just going to let you do lightly. Because, well, I want to talk about how you can help people. That's
Sure.
really what I want
Absolutely.
to know. Let's talk a little bit about your background.
Yeah, so my educational background, I finished dental school in Brazil about 24 years ago. Then I thought I wanted to do research. I moved to Los Angeles and went to UCLA, did research, but that was not fulfilling enough. And then I did a 2-year program in orificial pain.
And how many people suffer from TMJ, and how does it get diagnosed?
It's very prevalent. A lot of people have it, but not everybody needs treatment. So, and to diagnose it, it takes multiple steps. Since it's not a condition that is caused by one single factor, but many factors, multiple factors, when diagnosing, we need to take in account all of this and also do a thorough examination, look at the muscles, the joint, the neck, the nerves. So, and in addition to gather a very detailed history from the patient and imaging. So it's a process.
I want to ask you why somebody would come to you as opposed to saying, well, I can go to my dentist and I can do that.
Well, dentists sometimes can help, but in many instances, TMJ patients are quite complex and they require a little bit or more in-depth.
I want to go to an expert, right?
Yes.
It's really, that's the difference. Somebody's an expert, and when you're an expert, and you do quite a bit, I want you to talk a little bit about that. So you've diagnosed them, what happens next?
So once we have all the information necessary to have an accurate diagnosis, I talk to the patient, and then we try to find, or I recommend, the most appropriate and best available treatment that will, serve that patient the best.
What are some of the treatments?
We specialize at Head Pain Institute in providing conservative care. So that includes medications, oral appliances like splints, cold laser. We do several type of injections. So we offer all of this.
So, okay, they come into the office, they've been diagnosed now with TMJ.
Yes.
And you say that you do a conservative care, which I think that's great, because
Yes.
most people don't, right? So, and you have a consultation with the patient?
Yes.
Are they kind of working with you to know what we should do, what they're willing to do, what they're not? How does that work?
Yes, so I explain to them every aspect of their treatment, what it involves, what structures are we targeting, right? And then they get to decide what parts, if they want to do everything, or if they want to go
Baby steps.
little bit more,
Aggressive.
slowly
Okay.
or slowly.
Okay.
Yes.
Well, now, their phone number is 480 945-3629. They're located in Scottsdale. Their website is headpaininstitute.com. People out there don't realize that they don't have to suffer.
No, they don't.
They don't.
No.
And there's treatment, and there's also conservative care. And I like the way that you talk about that. Now, you talked about shots. I gotta ask you.
Mm-hmm.
Where do you put them?
They can go in the muscle,
In the face?
yeah, in the face, in the neck.
Okay.
Yes. And whatever muscle is at that point, painful.
What does it do? Does it relax it? What does it do?
There are several mechanisms to it.
Okay.
It helps the muscle relax, and also it kind of triggers a reaction in the patient's own body that helps alleviate pain. So that's one of the mechanisms.
So when you're dealing with something like this, maybe you or someone that you know, and we all know people who are in pain, that is for sure.
Yes.
And head pain is probably one of the worst things. Do people come to you for migraines too?
Yes.
Let's
yes.
talk about that for a minute.
Because TMJ and migraine are closely correlated. Usually the patients that suffer from TMJ have a higher risk to have a migraine and vice versa. So we usually see them together.
Yeah,
Yes.
I'm sure. And let me just say this, folks. What I love about this show, and I love my show, and that is because of the information that is here. And it might be for you, or it might be for someone that you know. Tell them about it, because you know what, especially when it comes, I know so many people that deal with migraines.
Yes.
And I'm gonna tell them, I'm gonna go back and do what I say, I'm gonna walk the talk and tell them about you, because, maybe they do have TMJ, and that's what it all, instead of it being something else, maybe I shouldn't say just TMJ, because that's pretty awful to have.
So what happens sometimes is the patients do have migraines but also have TMJ, but they are only addressing one of the issues, and usually that's migraine. And they don't get quite the relief that they're seeking. So in order for them to really feel better, you need to address both of them.
Their phone number is 480-945-3629. They're located right here in Scottsdale. The website is headpaininstitute.com. So what are the most challenges that the patients have?
I would say one of the most common challenges that we see is to find the appropriate care in a timely manner. When we receive the patients, very frequently they have had consults and treatments with at least a few other specialists, and they either only found partial answers or no answers at all. So that's, I think, one of the greatest challenges that they face.
So let me ask you this, you mentioned an oral appliance,
Yes.
correct? What does that look like? Is it small, is it big, is it easy?
It could be, really that big or small is more depending on the patient, how
Okay.
they see it.
Yeah.
But if you imagine similar to a night guard, pretty much that's what it will look like.
What's the difference between yours and someone that might say, well, I can get a night guard at the grocery store, whatever, the drugstore? What's the difference?
So, main difference is ours is custom made, and
There's a difference right there, folks.
Yes, and it comes with, we take full responsibility for the splint, and we take full responsibility for the patient who's wearing it. So we are able to troubleshoot whatever, is it working? Great. Is not working? Why is it not working? So that makes a lot of difference.
It sure does.
Yes.
Again, they're located right in Scottsdale. You could check them out on their website. It's headpaininstitute.com. The doctor is a dentist. That's what she is, but she specializes in TMJ, migraines, which most often if you have a migraine, you're really dealing with probably TMJ. So the phone number again, write it down. Maybe it's for you or someone that you know. It's 480-945-3629. It's headpaininstitute.com. Hang tight. We'll be back in just a minute. Did you like that?
Yes. I just need a little water.
What?
A little water.
So bring your water.
Yes. I have it here. Thank you.
Yeah.
I want it to be in the.
me just see, make sure we're into it. Are you liking it, Cheryl?
Yeah,
Okay,
I think it's great.
thank you.
I can see why you like what you do.
Yeah.
Thank you, I do like what I do. It's helping.
So much good information, helping
Yes.
people.
Exactly,
Yeah.
it's just helping them get the word out, talking about it. You're not nervous anymore, are you?
A little bit.
Why?
Um,
Don't be.
So you've been doing this here a long time with this group, this station?
I've been with them for 17 years,
Okay,
almost 18 years,
okay.
yeah. And so, I've never had my show anywhere else other than here and on television, but not another station.
That's a great relationship.
Yeah, it has been. It's been a trip, but I also pay a lot of money to them, so, they love me.
Well, clearly your audience sees
Hey,
that
they
you're giving
do.
them
I
a
mean, we
good
just had a guy
value.
that was on, they called the owner of the station, just so happened they called the owner of the station. I have the email from him and he says, hey, somebody was listening to your show and they heard the hypnotherapist, he's been on my show for 16 years.
Oh, okay.
Yeah, and I've heard him a lot, but I love that show, and I'm glad they called and said that right to them, but they do, they like it because first of all, it's not politics, right, it's something else.
Yeah.
And it's great information, and they know that with me being here as long as I have, some of them think they know me, and they'll call or text me and say, hey, I heard this, but, and with something like this, you can get it later, it doesn't happen necessarily right away, that's just the way this is. And we'll talk about it after the show, because I can help you with that part of it, but they do, they think they know me. And this has been the week of that, and I do think that now that the election is behind us, that people are now like, okay, now I can move forward,
Yes.
right?
We can start living
I
again.
can start
sort of.
thinking,
Yes. Yeah.
But after we're done, I'll explain to you how I think that you could even do it better.
Okay, all right.
Not that you're not, you're doing fine, you know your stuff, which is really good, right? But we can do some other things too to influence it. Okay, here we go. So welcome back, everyone. We're talking with Dr. Terrell. She's the owner of Head Pain Institute. She specializes in people who have TMJ. TMJ is probably one of the culprits of a lot of the different things that you are dealing with. You said migraine is one of them. What other forms of pain that really come possibly from TMJ?
There are a lot of other symptoms that can be associated. So neck pain, tooth pain, ear pain, ringing in the ears, like I said, sometimes dizziness.
Wow.
There are, yes, some of those symptoms that may seem unrelated.
And migraines, people don't realize, they think it's something they ate or they're allergic to or what have you, but a lot of people might just have TMJ. And it's harder to diagnose what the right treatment is than it is just to diagnose TMJ, or is that hard as well?
To diagnose TMJ, it can be challenging sometimes, especially when the symptoms are not clear-cut. For example, someone that is chewing and feels tooth pain, and they go to the dentist and they look at their teeth and their teeth are great, and no, you have nothing, but they continue to have the pain, and eventually if we see those people, right, and we do our muscle exam, we can see that sometimes that pain is actually coming from the muscle that they used to chew and is more of a referred pain.
I think what's really important too is that what you do is you called it, what did you call it? I'm sorry, I can't even read my own writing. It's conservative.
Yes.
There you go, I was writing fast. You try it, folks, it's not so easy all the time. So
Yes.
conservative care, and I
Yes.
want you to kind of talk about what that is, because the people that might just tuned in didn't hear that, right? And so I would like to talk about what the, your first level of conservative care is.
So conservative care, it can start with as simple as self-care practices.
So what are
Right.
some of those?
Some of those will be eating the right foods, and especially in people that suffer from TMJ, that will be softer foods, not so crunchy, not so hard, no gum. No gum is a big one. No ice chewing. So it could be as easy as that, and a couple of ibuprofens, and they will be, good to go. But we can start kind of escalating that if the patient is not responding, or if they're having more pain than just that. And then we go to the splints, and then if that also may not work, then we have injections and all different kinds of
Now,
injections.
the injections that you use, I just want to be clear,
Mhm.
okay?
Yes,
It's not like Botox or something like that. What is it?
we can,
Oh,
yes.
so it's this?
Yes, we have, it depends on the structure. We have what is called trigger point injections that go in the muscles. Then we have injections directly in the temporomandibular joint. And then we can use Botox as well in certain cases for certain people. For migraines, for example, chronic migraines, it's an approved treatment. So we do use it when indicated.
Wow. Now, what other treatments or conditions that you treat?
So as an orofacial pain specialist, there are other things that we see, not just TMJ. TMJ is just the most common one, but we see trigeminal neuralgia patients.
What? I'm glad you said that. What is that?
It's a dysfunction of the trigeminal nerve. The trigeminal nerve is one of the most important nerves in our face. They're responsible for making our muscles move, for all the sensation in our teeth. So sometimes this nerve kind of becomes hyperactive, let's say, and starts giving pain signals when there is really nothing. And it's very painful, very severe. It can really affect people's lives. So we do see some of those patients. We see sleep apnea patients. We also treat it like headaches. We mentioned tension headaches, migraines, and neuropathic pain, which is, for example, a person that has tooth pain, and either they don't have any real indication of a problem in the tooth, or they have had successful treatments like a filling, a crown, and a root canal, but the pain persists. That usually or can indicate that the nerve itself is being damaged, and we call that neuropathic pain.
Well, let me tell you something, folks. First of all, you got to take care of yourself, and it's important to know that what you're dealing with, whatever it is, could actually be diagnosed and treated. Okay. When you talked about sleep apnea really quickly, and
Yes.
a lot of people suffer from that. A lot of people suffer from that, and I just want to ask you on that. What do you do for those patients? How do you handle them?
So as a dentist, when we are treating sleep apnea, we use what is called a sleep appliance, which is a mouthpiece that is used in those cases. It is sometimes an alternative to CPAP, but it can also be used to treat mild and moderate sleep apnea.
So when they come to you for that, I want to make them very clear on this, because I had asked you before
Yes.
you came on. It's not like you're going to get an in-home test from them. You then order that test, correct?
Correct. Yes, we can order the test for the patient if they don't have one yet, but many of them come with one already.
Okay.
And then we see if they are a good candidate for the oral appliance, the sleep appliance, and then we fabricate them and manage them.
Their phone number is 480-945-3629. They're located in Scottsdale. Their website is headpaininstitute.com. Question on that.
Yeah.
Because a lot of people have these appliances that are big, and it's the mask and it's all that kind of stuff. What's the difference between that and what you offer?
You mean the CPAP?
Mm-hmm.
Well, the CPAP is
the oral appliance sounds kinda nice to me, because
Yes,
now you
it's
don't have that whole thing on your
yes,
face.
it can be, the CPAP can be cumbersome for some because it literally is putting pressure, air, into through your nose and your, airway. And some people cannot tolerate that, and it's difficult sometimes to sleep when you're hooked onto a machine.
Yeah.
And in certain cases, a sleep appliance will be like a great option for
Yeah,
them.
yeah. But you don't know until you have that consultation with them. Go in there and talk to them and find out what they can do for you. I do wanna ask you a couple of other things, what sets your practice apart from other people?
One of the things that sets us apart is definitely we have a very high commitment in providing excellent, compassionate care to our patients. And that started from the minute they call to try to schedule a first appointment. We understand that these patients have either been in pain for a long time or are in severe pain at that moment, or that they are very tired and frustrated from going from healthcare provider to healthcare provider with no answers. So we really have a commitment to try to schedule those patients, have them seen without a week to 2 weeks.
So I wanna make also this something clear right here and right now. They're not coming to you for a teeth cleaning.
No.
Oh, that's what I just wanna get that out right now, right?
We don't, in
Aren't
our
you glad I asked
office,
that?
we do not even have dental chairs.
See, so it's different,
It's different.
okay?
Yes.
Right?
Yeah.
And so, you're not going there for your dental work, you're
No.
going there because you have pain. The pain that is coming from your head could be from your jaw,
Yes.
Right?
Absolutely.
and, do you do x-rays? How do you start that process?
So after we have gathered like the detailed history, because we really want to understand from patients' perspective, with patients on wards, what is happening, what's been going on, what are their symptoms.
And everybody has their own story, I
Yes,
betcha.
everybody's unique.
Does it start with people grinding their teeth? Or does that have nothing to do with it?
It has.
It does.
It's not the only factor, but it has, and it can have a lot to do with it. So after we gather all of that and I do my exam, then I determine usually what type of imaging they will need. Because more often than not, we do need imaging. It could be a CT scan or it can be an MRI as well.
Okay.
Yeah.
And why did you decide to specialize in this field?
I always knew I didn't want to be a general dentist, and that's why I decided to do research. And I love the research part, but full-time was not my thing also. So while I was doing my PhD, my best friend at that time, she was doing orofacial pain. So she used to talk to me about it and take me to the clinic with her and help me when sometimes I had some pain. And I got interested. And I did the residency, and it just so happened that it became my passion and my career.
And why should somebody who is dealing with TMJ go to a TMJ specialist?
Because you can find the specialized care. If you have had pain, jaw pain, or symptoms like that, and you have tried the soft diet, you have tried the ibuprofen, you even tried the night guard from your dentist, and you still don't have answers, I think that's when you definitely need to look for a specialist.
I couldn't agree anymore. I feel it very strongly. You don't want to just go to your dentist and have them do it. That's all you do.
That's
You're
all we
working
do.
on people
Yes.
who have TMJ. You may not even realize that you have it. Their phone number is 480-945-3629. They're located right in Scottsdale. You can check them out on their website, which is headpaininstitute.com. Again, maybe it's you or someone